the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:24. School starting back up for the majority of school-aged kids, and with that comes the opportunity for doctor visits. Of course, Dr. Laura Lester from Baptist Health Family Clinic in Malvern drove up this morning, and she's got some advice on something she's seen more of these days, and close contact with more kids is not the reason for it. Dr. Lester, good morning. What is the thing you've probably seen the most in recent weeks that kind of concerns you?
Yeah, poison ivy. Everybody's getting out and clearing their fields and clearing stuff and tearing down bushes and all kinds
of set for deer season,
just covered, and it's miserable looking.
Yeah, and it's something too that I think a lot of people think like, oh, I know what it looks like.
Right.
Well, I'll avoid it.
Or they'll just wait it out.
Yeah.
And not always can you wait it out. I mean, a lot of times you need some medicine. You need some help with it.
Is it depending on the person though? Like, let's talk about the allergic factor
like
to it.
50% of people, they say, will have a reaction to poison ivy.
Really? Just
50, which seems kind of low to me.
It does. Like any reaction at all?
Yeah, that's what the
CDC say.
So, you know, maybe not. Who knows? Maybe that's just what's observed.
Sure.
But I do know it can change. Your reactions can change with age. So you can have a really bad reaction when you're little, then you can kind of grow out of it, or you can become more reactive. And because I've had people come in that are older and say, I never had this before. Like I was around poison ivy all the time, and so you can. Just like any other allergy, it can change with your age.
What is it with something so variable from person to person? How do you go about treating something like that if it's a pretty bad reaction that they need help with?
The steroids are the key.
Okay.
So steroid cream, a fun fact, I guess, if you want to call it that, antihistamines, the anti-itch medicine, they will not stop the itching from poison ivy.
Really?
Yeah.
So even the ones who have, you know, the label on there that says poison ivy,
it doesn't stop the itching. The Benadryl and things like that make you go to sleep will help you avoid itching because you're asleep, but they don't stop the itch. The steroids are the thing that stops the itch because it's the that hypersensitivity rash.
Okay, we've got pictures of it on screen right now.
Yeah,
so these are the rashes to look for. If you've got these, this is the sign of poison ivy.
A lot of times, because it comes from plants and things like that, you'll see these streaks.
Yes, they kind of streak across your arm,
and
right?
Yes. Streak up, and that's where you brushed against it, and it, you know, there's a chemical on poison ivy, poison oak, and poison sumac called urushiol, and I probably East Texted that to death, but
no, that's fine.
Anyways, that's what causes the reaction, and so once it gets on your skin, you can scratch it and absorb it get it under your fingernails. You can get it on in the oil of your skin, and then you scratch somewhere else, and it just
spreads
takes off.
Oh.
So the leaves of 3, let it be. That's the rule.
3 different kinds here. I mean, they don't all look the same. Yeah.
Poison ivy, poison oak, and poison sumac. And so they're all, I mean, they're pretty, but they're not fun. And so this can even brush onto an animal's fur.
Like a dog or cat?
Yeah, and then you can pet them. And I mean, it's crazy the way you can get it just to come in contact with that.
Okay, so wash your dog, if you go out with your dogs in the woods too, something like that?
The name of the game is like, they say to within 10 minutes of exposure, if you'll wash with soap and water, don't scrub, don't rub anything. Just wash. Lightly wash, and that will decrease your chances. But if it's bad, go see your doctor. Get some steroids. Don't suffer.
Dr. Lester.
Yes.
And go see the folks at Baptist Health Clinics around the state. Of course, there's one in Malvern. That's where Dr. Lester is. There's also a list of locations on their website at baptist-health.com. Dr. Lester, thanks for driving up this morning. We'll see you next time.